So what do 7 million people in the United States have in common? And that list is added to by almost 500,000 each year. That is vision loss. And we're going to be talking about vision loss today. I just want to go through some of the main types of vision loss, because I very frequently have people ask me, well, what kind of vision loss is there? There's eyeglasses, and what else is there? There's a lot of things here. We're going to go through these quickly. And by the way, I'm going to go through each one of these more in depth. I'll be actually publishing a number of different videos that will each go into each one of these and explain them in depth. So if you have a particular type of vision loss that you have yourself, or maybe a family member has, that'll be a video that you can look up here very shortly. We'll have that hopefully within the next week or two. So anyhow, the vision loss, so the main one, the first one let's talk about, that's refractive errors. Fancy name for nearsightedness, farsightedness, astigmatism, presbyopia. These are all conditions that cause blurred vision, and in most cases they can be helped with eyeglasses, contact lenses. There's actually some eye drops that can help that, and two different kind of eye drops that come to mind initially. One is for people that have nearsightedness or myopia, that increasing nearsightedness occurs. There's actually a drop on the market now that's approved by prescription only. It's a atropine drop, and what it does is it's a very weak atropine. It's a drop that's used, and it actually has been proven to slow the rate of progression of myopia down. There's actually a new lens on the market, an eyeglass lens that has been shown to do that. And then there's another drop that actually can reduce the effects of presbyopia. You know that after 40 condition where your arms aren't long enough and you just can't get around to doing arm stretching exercise to make them longer. Anyhow, there's a drop for that does reduce your dependence on reading glasses. So, but those in most cases can be helped with various and easily accessible lenses. One thing to not overlook, and that's myopia. Myopia, as it increases, in fact, moderate to high levels of myopia, you have a higher chance of retina tears, retina detachments, retina thinning, glaucoma, those kind of things. So it's something you really don't want to take lightly. And if you have high levels of myopia, that's definitely something that you want to have your eyes checked and check your eyes at least every year or more frequently, depending what your eye doctor says. And by the way, I'm not here to diagnose or treat eye disease today. I'm here just to pass on information that I've gained over my 36 years plus, and in a way of teaching, because I was a teacher for 5 years in Citrus County, and I love doing that kind of thing. Well, next thing is amblyopia. Another name for that is called lazy eye. And lazy eye is not where the eye turns in or out. That's called strabismus. That's a different condition. But amblyopia is where the vision doesn't develop in one or both of your eyes, where the clarity doesn't develop, where there's connections not made in the brain. And even with the best glasses, best contact lenses, you're still having trouble seeing clearly and sharply. Most cases it's about 2200 or less, but it can be fairly debilitating. And like I said, it can be both eyes. I've seen a number of cases where the vision didn't develop in both eyes, so that's a bilateral amblyopia. Or you can, in most cases, you can have a monocular, where it's just one eye. And now it can be caused by glasses that are not correct, not wearing glasses when you should, having a big difference in the prescription of the two eyes, maybe not needing glasses in one and nearsightedness in the other eye, those kind of things. And that can be treated in most cases. Definitely want to attempt treatment if you're under 18. That's a standard of care now. If you're over 18, I'd try it. We've had great success with amblyopia, treating that in ages over 18, into the 20s, 30s. I've had some patients even into the 60s. But I do have to admit, the older you get, the less quickly the improvements come, and the end point is usually quicker, where you don't get as much improvement at age, say, 40 as you would if you were age 20. So keep that in mind. Talk to your eye doctor about that too, or if you have questions, any of these here, just give me a call at the office. We do free phone consultations all the time, and I love doing that with people. Trauma is the next one. See lots of trauma, vision loss due to that, due to foreign bodies, sharp pokey things, and things that can cause damage to the eye, the cornea, the retina. You get BBs and fish hooks and you name it. Most of those kind of traumas will cause some permanent vision loss. But trauma of the eye, I'm sure you know this, and you would be running right to the emergency room, and by all means do that. The quicker you can, the better. Glass in the eye, you don't want to try to treat any of these at home. If something's in the eye, if you have a foreign body sensation, give your eye doctor a call, or at least minimum go to a walk-in clinic. They'll stabilize your eye and get you into the ophthalmologist, surgeon, or somebody ASAP. So that's really, really critical to do that. But trauma can cause vision loss that's long-term, lifelong. But if you have vision, any vision remaining, we can typically, in most cases, make it better with the low vision exam and different types of optics, high-powered telescopic devices, and so on. Glaucoma is another one we see very, very frequently in the office. Glaucoma is a condition that is treated by lowering the pressure of the eye. It's caused by damage to the optic nerve. The optic nerve is what takes the image from the back of the eye, the retina, back to the brain. It's about, give or take, about 1/8 of an inch in diameter. And in that optic nerve, you have 1.2 million connections running through that optic nerve, taking a signal back to the brain. And with glaucoma, you're actually losing some of those fibers. As 1.2 million connections reduce in number, as you reduce those connections, visual clarity, visual acuity decreases. You become more sensitive to glare and more sensitive to changing of light and less able to adapt to that. And your contrast sensitivity, how much contrast you need, also increases. Your contrast sensitivity decreases, you need more light to increase the contrast, and you'll have trouble going up and down curves and steps and things like that. Easily treated, rarely 100% controlled. It can be in many cases, but not always. And in fact, in a lot of cases, even with the best of care, you can still lose vision over time. So the main goal with treating glaucoma is obviously to stop it. But the main effect, if we can slow it down, try to slow it down as much as possible to maintain vision throughout your lifetime, that's one of the main goals. We have some great glaucoma specialists in the Tampa Bay area. I love them all. They're great people. Diabetic retinopathy is another condition. It's a disease of the retina. The retina is like the film of a camera, and diabetes over time does cause issues with that. You know, any tissue of the body that has a lot of capillaries in it is affected with diabetes. And one area of the body that has rich capillary bed is the retina, and the retina is obviously affected by diabetes over time. In fact, most people with diabetes, after they've been diagnosed, maybe about 10, 15, 20 years into it, you'll start to see little changes of the retina that can eventually, with time, in not all cases, but in many cases, can cause vision loss, parts of your vision missing, blurry vision, and so on, and can, in very severe cases, cause retina detachment, retina tears, and very, very severe vision loss. But if you have vision with that also, in most cases, we can make that a lot better than it is. Key there is maintaining a great relationship with your retina doctor, great relationship with your endocrinologist and the doctor treating your diabetes. And if you haven't had or had a chance to talk to a certified diabetes educator, CDE, talk to one, make an appointment with one. They could be a great resource in helping you maintain your blood sugar levels, maintain a more stable A1C, and could be a great resource for you. Retina detachment is another one. Retina detachment is where the retina, the film of the eye, that's like the film of a camera, the film inside the eye, that is where the picture starts to be made. It detaches. It can either tear or detach, pull loose from its supporting membrane, from the membrane and a tissue that provides oxygen, takes waste products away. And that is a medical emergency. Retina detachment, the sooner that's treated, the better the outcome will be. And if you have some of the signs or symptoms of retina detachment, which I'll talk about in a minute, you want to get into an ophthalmologist, retina specialist, ASAP, I mean stat. Go as fast as you can. If you can't get in to see somebody like that, you want to get into a walk-in clinic or an ER, and they'll have somebody that they can call to get you seen. And time is of the essence with the retina detachment. Typically, the most common signs or symptoms of a retina detachment are what people say they see a shower of spots. Not the 1 or 2 or 3 spots you see sometimes, but a shower, like thousands or hundreds of spots in your vision. Or what looks like a sheer veil, almost like a sheer curtain waving in the wind, or coming down or coming up in your vision. Those are some of the more obvious signs or symptoms of that. And sometimes it's just a flash of light. Sometimes it can look like a big flash bulb going off, if you remember what flash bulbs used to be like. Or even sometimes I've had a few patients where they said, it was like a little twinkling light in my peripheral vision. So it was way off to the side, but kind of looked like a little twinkling Christmas light. So if you have any of those signs or symptoms, call your eye doctor's office. If it's after hours, try to get into a walk-in clinic or see somebody about that, okay? So that's really critical to do that, because the sooner the better, sooner it's treated. If you have vision loss due to retina detachment, in almost every case, if you have vision remaining, we can make it better for you. Macular degeneration, age-related macular degeneration, whether it's a wet type or the dry type, that's loss of vision in your central vision, and it's a central vision that was designed to see color, see detail, recognize faces. So if you have macular degeneration, What do you have problems with? Reading, seeing detail, recognizing faces, seeing colors. But that can be easily improved. If you have vision loss just due to macular degeneration, I would say almost every case we can make the vision better. I can't make it perfect with the low vision exam, but in most cases I can make it better than it is. In most cases, usually about twice or 3 times better than it is. And that's a big improvement over what most people experience. And if you've been told there's nothing that can be done to improve your vision, give my office a call, all right? Or go online, look at our website, do some Googling on low vision or resources for low vision and high-powered telescopic eyeglasses, many different types of optics. We work very closely with occupational therapists to provide vision rehab in your home. And in almost every case, that's covered by major medical insurance. So a lot of resources we can bring to the table to help you. We can get disabled parking permits for vehicles you travel in, not that you're driving, but vehicles you travel in. Reduce your property taxes if you meet the criteria for that. Talking books, free currency readers. There's a lot of resources that are available if you have a vision impairment, if you meet the criteria for that. And that's what we're here for. We're here to help you with anything we can and bring all the resources that I've gained over my 36 years. A few other things, cataract. Of course, cataracts used to be a big bad problem, but in most cases they can be improved by removal. We have great cataract surgeons in the Tampa Bay area. In fact, we're probably Tampa Bay area. The ophthalmologists in this area were the actual leaders in developing new cataract surgeries. And very, very short, simple procedure, usually 10, 11, 12 minutes. And the ophthalmologist can improve your vision. Now, if in some cases it happens, you have cataracts that are not operable, can't do an operation for it, we can help your vision. We can make your vision better through special magnifying lenses, adding magnification to your prescription. It can help that. And various other things that can help you reduce the glare you might be experiencing or the double vision or even color distortion. Infections. You can get infections like a uveitis, infection inside the eye. Sometimes if you get injections in the eye, you can get infection inside the eye. And infections that linger or can't be treated properly, or an infection of the cornea, like a corneal ulcer, those can cause scarring in the eye and can cause vision loss. But in most cases, that can be improved too. We can improve that vision. Maybe not make it perfect, but better than it is. And the last one I'll talk about today, that's neurological, like strokes, head trauma. Trauma that causes brain damage, strokes. In fact, 1 out of 10 people that have a stroke will have some type of vision loss. In most cases, that vision loss is a field loss, where they actually have half their field of vision loss. You can actually have half your field of vision loss on both eyes. So split your vision down the middle. On one side, the right side, or the left side, you can lose all your vision, called a hemianopsia. You can lose partly, like a quadranopsia, where a quadrant of your vision lost. So there's different ways that vision can be lost due to brain injuries, brain traumas, strokes, and so on. But in most cases, we can improve that. There's prisms, there's ways of expanding your field of vision. So that's a quick, big 30,000 foot overview of different types of things that can cause severe vision loss. Hopefully you gain something from this. If this information helps you or somebody else, please pass it on to somebody else. I'd love to expand my field of out further and let other people know that there's something that can be done. My biggest the thing I hate hearing most is people that said, I've been dealing with this vision loss for a year or 5 years or 10 years. I didn't know there was anything that can be done. And within 1 or 2 visits to the office, their vision is 2 to 3 times better than it was. And I just love helping them, but I'd love to get them in the office much sooner so they don't suffer for years with vision loss. So until next time, watch for the next series of videos coming up. If you have any comments you want to, if you have any questions, do post them for me or give my office a call. And I love hearing from you. Our office is New Eyes Low Vision Solutions in Palm Harbor. Our office number is 727-463-2579. Until next time, this is Dr. Ed. Have a great day.